I would like to welcome you all here today. Though for those of you who don't know me, my name is Eva Orsmond, and I'm a medical doctor originally from Finland. I've been focusing my medical practice for the last 20 years here in Ireland, helping adults and children to improve their health through weight loss and improved diet. And now I have a team of nutritionists working with me, and we have 2 clinics, one in Galway and one in Dublin. And the last 15 years I have been focusing increasingly in my work helping diabetics to lose weight and improve their glucose control. Because improving the glucose control is the only way to avoid the long-term health consequences of diabetes. We have had absolutely fantastic results over the years, not just helping type 2 diabetics to improve their glucose control with less reliance on medication, but in many cases also totally to reverse their condition. Now, the last 2 years have been very challenging at all levels for all of us, and many of us has sought comfort in food, and with less exercise available, either psychologically difficult to do or just not physically easy to do, this has all resulted, excess weight gain, and we have been talking about the famous COVID stone or 2. I hope that my talk today would inspire and motivate you to take that step, to commit to do that lifestyle change and lose weight and improve your health. You will be hearing some inspiring stories from past and present patients of mine, and I hope that that together will convince you that carrying excess weight is not healthy, and you can only gain by losing weight and improving your diet, not just in years of life, but also in quality of life. I always say to myself, even today standing here, after all the years being doing television work and being in the media, I still feel nervous standing here and talking to people. And I say to myself, feel the fear and do it anyhow. And this is the same advice I would give to you. If you feel the fear of starting and taking that step, feel the fear and just say, you have to do it. Trust in yourself, and the rest will come. Before I start my presentation, I would like to make a very clear distinction that when I'm talking here about diabetes, I'm talking about type 2 diabetes, because type 1 and type 2 diabetes they are the same name, but actually it's unfortunate this is the case, because type 1 diabetes is a totally different condition. It's autoimmune in its origin, and type 1 diabetics cannot reverse their condition. They need lifelong injections of insulin because there is a total lack of insulin in the body. But type 2 diabetes is initially a disease of insulin resistance. And in majority of cases, type 2 diabetes is a lifestyle disease. Like anything in medicine and anything in life, there's always a minority and there are exceptions. There are also type 2 diabetics who don't carry excess weight, but typically type 2 diabetes is a result of excessive amount of visceral fat, which is that deep fat in the visceral cavity which wraps around your liver and your pancreas and your internal organs. And that is the place where we should not have too much of that fat. And when there is excess amount of fat, you obviously start seeing that our tummies start bulging. But it's not actually the fat that you can pinch between your fingers. That is subcutaneous fat. That is not dangerous fat. But how much the tummy is bulging is reflecting how much is in that deep visceral cavity. Now, that's where the process of insulin resistance starts. So type 2 diabetes, in the beginning, there is an excessive production of insulin. And sometimes when you read information about diabetes, there is a confusion, and sometimes I don't know if it's done on purpose, that it made almost to believe that type 2 diabetes, that there is a defect in the production of insulin. Type 2 diabetes, there is no diminution of the insulin in the beginning. There's actually excess amount of insulin produced, where in type 1 there is no insulin. And this phase, which is, we can call pre-diabetes or metabolic syndrome, and I don't want to go too technical to bore you, but it can take 10 years silently in your body. So your body having this visceral fat, with the mechanism of initially the fat goes inside the liver and basically creates what we say this insulin resistance, and then around the pancreas and inside the pancreas. At the beginning we have increased insulin production and the sugar readings still stay normal, but with time then there is the resistance, the insulin resistance creates further, and the body is producing more and more insulin, and the sugar readings start slowly increasing. And when the sugar readings are higher, but not high enough to give symptoms, clear symptoms, slow silent damage is already happening. And some people either get diagnosed with type 2 diabetes by random blood test by their GP, and they find out that they have high sugar readings and they are surprised because they feel that they didn't have any symptoms. And then they in hindsight say, actually I was thirsty, I was tired, I was having more thrush, I was having more urinary tract infection, and they start looking back. But because everything happens silently over the years, people get used to these symptoms. Then there could be also that case that a person wakes up in ICU after having a heart attack, like one gentleman who was here during the last session told me that what happened to, that was how he discovered that he had type 2 diabetes. So what the message here today is that these non-diagnosed diabetics or pre-diabetics are around 100,000, this is the estimate, in Ireland alone. And if we could prevent those cases progressing and discovering them earlier, we wouldn't have these long-term health consequences. Obviously this is affecting the person's quality of life, their health, but it's also very costly for the society, because once the type 2 diabetes has established properly, it needs intensive medication and intensive care at different level, because there is not one part of the body that doesn't get affected by the type 2 diabetes. I was yesterday listening to a further education talk aimed at GPs to help to manage the cardiovascular complications of type 2 diabetes, and the professor who was giving this lecture said, I always tell my patients that type 2 diabetes is not going to kill you. The cardiovascular disease that diabetes is creating is going to kill you. But we're talking about heart, we're talking about kidneys, we're talking about Alzheimer's disease, we talk about neurological conditions. For example, the type 2 diabetic polyneuropathy, which is it's a type of pain that hardly painkillers can help. So obviously then we talk about blindness and amputation. So the range is huge. So it's something that type 2 diabetes really should be taken seriously. And it all starts silently with this excess fat. And when people are diagnosed with type 2 diabetes, typically in Ireland, unfortunately still the situation that people are told you suffer now from a chronic progressive disease. Chronic in that you will have it forever, progressive that it will only get worse. And people are prescribed a combination of cocktail of drugs, which goes from metformin being the first approach, blood pressure, aspirin, and statins, which are to treat cholesterol. And it can become quite a shock for many people when they are told that from going from zero medication, they suddenly on a cocktail of drugs. And what I find particularly sad and makes me feel angry when people are told that they have a chronic progressive disease. Because while type 2 diabetes is chronic progressive disease, it's chronic progressive disease only when you don't do anything about your lifestyle. Because we know from scientific evidence that type 2 diabetes can be reversed, almost guaranteed if it's within 5 years of diagnosis. So what we call newly diagnosed diabetes. So when it's less than 5 years of diagnosis, we call these people newly diagnosed diabetics. Then after 5 years, obviously nothing in medicine is a clean cut like what I'm explaining it here, but we obviously have to limit times. We say when it's after 5 years, and depending what type of medication the patient has been on and what is their, obviously, their DNI and their body, then either what's the percentage of the beta cells has died or not. So it becomes less guaranteed that you can reverse it. Now I have people who have been 15, 20 years diabetic and they have been able to reverse it. And then I have people who have been able to improve their diabetes to the condition, to the level that they don't need the medication and they can actually have it dietary controlled diabetes. But obviously, in my opinion, it's already a success if you can control your diabetes without prescription drugs, because all these prescription drugs comes with the side effects. And this is something that people often ignore to read the leaflets and look at the leaflets, because it can be scary read, because type 2 diabetes as a condition is already increases your risk of cancer. And many of these type 2 diabetic drugs as a side effect has also increased risk of cancer. And many of the type 2 diabetic drugs have as a consequence and a side effect weight gain. And weight gain is a further increase of worsening of the type 2 diabetes. So you can see how, in a way, these drugs to use to treat type 2 diabetes almost, in a way, makes you into a vicious circle. So, like anything in life, prevention is better than cure. The diagnosis, as I was saying earlier, it's not just what happening in your body, but it's also the mental health effect of the shock and people feeling that now they have something chronic that they can't do anything about. But what is made worse is that if you are lucky enough that you meet and you are sent to a dietitian, unfortunately still in our hospitals is prevailing this food pyramid advice, and the typical advice is still based for diabetics to give carbohydrates. Now, there's a bit of a bizarre contradiction there, because if you have been put on these diabetic medication, which obviously the effect is to take the sugar readings down, you actually need carbohydrates. Because if you are on these medication and you don't take the carbohydrates, you are risking hypoglycemia. And hypoglycemia is when your sugars goes too low, and especially older population, this can result in falls and all sorts of things. And if it's too low, it can be lethal, and basically you can die in minutes. Nobody's sugar reading can go unnaturally low if they are not on medication. And this is where I'm trying to explain why type 2 diabetics, when they go on a weight reduction diet, they need medical supervision, because the medication needs to be adjusted. Depending what your HbA1c level at the beginning is, how much of insulin resistance or beta cell damage you already have. And this is individual in every single case, and you can't say that at the beginning. You will establish that with the blood test and while you do the diet. And when I finish my talk here, I will introduce some of my guests who have done the diet and have reversed their diabetes and their story, and then you can ask questions and I'll try to answer my best. So this food pyramid was slightly changed a few years ago, but it's still very much based on carbohydrates. You see in my Reverse Your Type 2 Diabetes, my food pyramid, and that food pyramid is aimed for people after they have done the diet, when they are in a maintenance phase, to try to follow the new way of living. And I personally believe that there is space in everybody's diet for a little bit of sweets. I'm not nowhere perfect myself in my diet. I sometimes totally overindulge, but I do believe that if we follow the 80-20 rule, so 80% of the time we are good, then we can actually afford 20% of the time be like the way Irish people say bold.